So how are you going to evaluate their behaviors? I would not suggest that you try to talk the partner out of their belief about themselves until you have a very strong ongoing relationship with this client where you have somehow gotten them to trust that you are seeing them and you're seeing the things that they have to offer and you're validating the things that they have that are going well, and maybe start to bring in at some point that this is not serving what their goals are, right? That's kind of like the backdoor way to work with someone that's overly focused on their needs and has very little empathy for the person that they're in a relationship with. And maybe it isn't what you love saying to your clients, but maybe sometimes you have to say, listen, you're not getting your needs met, right? If you don't start giving space for the other person to have some time to talk about what they need and you respond to them in a way that shows that you care, you're never going to get your needs met. So this is a good starting point for us to start practicing that. And that may be a workaround for that client, right? It's also important to remember that there may be another overlying mental health issue happening for these clients. It is not unheard of, and in fact, very frequent in my practice with my clients that have personality disorders or traits of narcissistic personality disorder, that they have depression and that they sometimes have OCD. So if you are really in tune with your clients, you might check in if they're on any kind of medication management, and you may want to even check in with that provider and see if they have any insight that could help you work with this couple. I'm also trying to get my clients to understand the way that they are going about their needs is not working for them. So as I kind of said earlier, helping them understand that the way that they're responding is keeping them in distress versus you need to change because that's the right thing to do, right? You would want to approach these clients the same way that you would approach them if you evaluated that contempt was present. And so again, that returning to the psychoeducation of helping you use I statements and leaving you out of them is going to be easier for your partner to hear and more likely to help you get your needs met.